Next, we have items number 1 and number 8, both Assemblymember Mullins bills, AB 50 and AB 461. And immediately thereafter, we'll be going to the special order of business, item number 14, AB 775, Assemblymembers Chu and Burke. Whenever you're ready, Assemblymember Mullen, please proceed.
Thank you very much, Mr. Chair, for taking these two items. I know we have the special order of business pending. Good afternoon, members. I would like to begin on Assembly Bill 50 by accepting the committee's proposed amendments. The Nurse Family Partnership Program was designed to help first-time parents succeed by cultivating deep-rooted relationships with first-time moms. The program improves maternal and child health outcomes and begins to help break the cycle of intergenerational poverty. NFP doesn't just change lives, it also saves the state money, saves Medi-Cal dollars, and improves our goal of government efficiency. The program is simple. A nurse works with a first-time mother during her pregnancy, discussing nutrition, offering support, and preparing her for birth, and then continues during the child's first 2 years. The nurse answers questions and offers advice on effective parenting skills that can lead families to self-sufficiency. There was a recent study by Dr. Ted Miller of the Pacific Institute for Research and Evaluation, including over 30 studies of NFP data, reports, and cost-benefit analyses, projecting that the state and federal government cost savings due to NFP's outcomes will average a little over $23,000 per family served, with 55% of all government cost savings per family served accruing to Medicaid. In California, those numbers translate to a total government cost savings of almost $19,000 per family served, which represents a $4 plus return on investment for every dollar invested. California can serve up to a little under 5,000 mothers in the program now, but we know that nearly 100,000 could be eligible each year. If half of the eligible mothers participated, the state could save hundreds of millions of dollars. And with me to testify on AB 50 is former state medical officer and director for the California Department of Public Health, Dr. Mark Horton, and Chris Krawczyk and Charna Martin from NFP to answer technical questions the committee might have.
Please proceed when you're ready.
Chairman Bonta, Vice Chair Meyenstein, and rest of the Assembly members. Did I pronounce it incorrectly? Right. I come today as a pediatrician and public health official, the former state health officer and director of the California Department of Public Health, to express my full support for the Assembly Bill 50, the Nurse Home Visiting Program bill. The problem: California's many low-income, first-time moms experience poor health outcomes for themselves and their babies and rely heavily on publicly funded and health and social support programs. The solution: evidence-based nurse home visiting programs provide the in-home support families need to improve their health outcomes and reduce their dependency on publicly funded health and social safety net programs. More than 3 decades of data on the Nurse Family Partnership Program show that the in-home support of a nurse during pregnancy and through the child's first 2 years of life helps first-time moms effectively navigate the healthcare system, have healthier pregnancies with improved health outcomes, and provide a healthier first start for their babies and become economically self-sufficient. So how are we doing here in California? In California, about half of all the births are to mothers covered by Medi-Cal, and about 40% of those are first-time mothers. That's roughly 100,000 families that could potentially benefit from the Nurse Family Partnership Program. 21 counties have implemented the Nurse Family Partnership Program. A total of 3,650 families are currently enrolled in the program. With the support of their nurses, many of these mothers have finished education, obtained stable jobs, left abusive relationships, eliminated risky behaviors to become the best mothers they can be. Their children are healthier, better prepared for school, have higher academic achievement, and are less likely to suffer from mental health problems and get involved in crime. But with less than 5% of potentially eligible moms currently enrolled, we've barely begun to realize the program's significant health and social benefits. At a time when Medi-Cal enrollment continues to increase, it's important that we connect Medicaid-eligible mothers with nurse home visiting programs that can improve their health and reduce Medi-Cal expenditures. So what does AB 50 do? The bill would not create a huge new publicly funded entitlement program. The counties that have already implemented the program here in California have come up with a variety of creative ways of implementing and funding the program. This bill would simply direct the Department of Health Care Services, working with key community partners, to develop and implement a plan that to develop, bringing the program up to scale for all the communities here in California. I urge you to give AB 50 due consideration. Your support for this bill will result in significant improvements in the health and social well-being of California's many low-income, first-time moms and their families, reducing their dependence on health and social safety net programs. Thank you very much.
Thank you. Additional witnesses in support.
Good afternoon. My name is Anne Marie Schubert. I am the District Attorney of Sacramento County, and I'm here on behalf of an organization called Fight Crime and Invest in Kids. It's an organization that represents about 400 chiefs of police, district attorneys, sheriffs, as well as victim advocates across this country. And I'm here as the District Attorney of Sacramento essentially to talk about this bill in the point of view of public safety. For the last 25 years, I spent my career in a courtroom prosecuting all different kinds of cases. I believe very strongly that my role as the district attorney now is public safety, which not only includes prosecution, but on the front end, which is prevention. And so when I looked at this bill by Assemblyman Mullen, I feel very strongly that this is exactly the kind of bill that we need in the arena of public safety, because if we are able to get to at-risk mothers, provide services to them that they desperately need, we can then prevent child abuse. And any of us that have worked in this field of law enforcement knows that much of what plagues our community is rooted in child abuse and neglect. And if we can deliver services on the front end through these types of home visit programs, we can then reduce the number of victimization that comes down the line, but also the alarming rates of arrests of individuals who become abused or neglected because of their situations that they are unable to get out of. So I believe very strongly in this bill. I support this bill. And on behalf of Fight Crime and Invest in Kids, I ask you to do that, which is to invest in kids so that at the end of it all, we can fight crime. So thank you for that.
Thank you. If there are additional witnesses in support, please state only your name, organization, and position.
Janina Perez with Children Now in support of AB 50. We look forward to working with the Assembly member to ensure that more evidence-based voluntary home visiting is available to Medi-Cal families.
Thank you. Others in support? Seeing none, witnesses in support,
Yes.
please.
Jonathan Zachariou, pastor of Davis Christian Assembly, in support of AB 50. Great idea.
See, any other witnesses in support? Seeing none. Seeing one.
Hong Gan Pham, Next Generation Policy Think Tank in San Francisco, in support of AB 50. Thank you.
Thank you. Any other witnesses in support? We have a motion and a second. Seeing no witnesses in support, any witnesses in opposition? Seeing none, questions from committee members? Seeing none, Assembly member, would you like to close?
Respectfully ask for an aye vote, Mr. Chair.
Thank you. We have a motion. We have a second. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Aye. Chavez, aye. Chu? Aye. Chu, aye. Gomez? Aye. Gomez, aye. Gonzalez? Hernandez? Lackey? Nazarian? Patterson? Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? Thurman? Aye. Thurman, aye. Waldron? Aye. Waldron, aye. Wood? Aye. Wood, aye. 10-0.
The bill passes 10-0. Assembly member, when you're ready, please present on AB 461.
Yes, I am, Mr. Chair. Presenting AB 461 relative to Coordinated Care Initiative pilot in my district. Thank you very much for your time today, Mr. Chair and members. I would like to start by accepting the suggested amendments, clarifying the language regarding voluntary enrollment. AB 461 would allow the Medicare and Medi-Cal dual eligible with developmental disabilities population in San Mateo County to voluntarily enroll in the Coordinated Care Initiative. The health plan of San Mateo is a local nonprofit healthcare plan that offers health coverage and a provider network to San Mateo County's underserved population. Unfortunately, the authorizing statutes of the Coordinated Care Initiative excluded dual eligible individuals with developmental disabilities from enrolling. To address this population, Health Plan of San Mateo has implemented a special needs plan that provides similar coordinated services. However, it has become administratively costly and financially burdensome to continue operating this small program of just over 600 individuals, and Health Plan of San Mateo will likely close this program affecting those individuals. Without this option, these 600 or so developmentally disabled will be left without a consolidated health plan to maximize their Medi-Cal and Medicare benefits. This is a county-specific bill with no opposition. AB 461 is supported by the Association of Regional Center Agencies, the California Association of Public Authorities for IHSS, County of San Mateo, Health Plan of San Mateo, the Golden Gate Regional Center, and local health plans of California. With me today, I believe, we have Koa Nguyen representing the Health Plan of San Mateo to answer any technical questions that you may have.
Thank you. Please proceed when you're ready.
Mr. Chairman and members, Trent Smith representing the Health Plan of San Mateo. Just stressing what the author just indicated, there is strong local support for this, and there is patient choice to enroll in this new plan if the patient so chooses. I do have Kwa Nguyen here to answer any technical questions if there are any from the committee.
Additional witnesses in support.
Oh, sorry. Chair and members, Kathy Mossberg with the Local Health Plans of California, co-sponsor of the bill, also in support. Want to thank your staff for working with us, and also happy to take the amendments as stated here by the author's office to reinforce that this is an option. Thank you.
Any other witnesses in support? Please state just your name, organization, and position.
Alex Hawthorne on behalf of County San Mateo here in support.
Daniel Savino, Association of Regional Center Agencies, also in support.
Thank you. Additional witnesses in support? Seeing none. Witnesses in opposition? Seeing none. Questions from members of the committee? Seeing none. Assemblymember Mullen, would you like to close?
Respectfully ask your vote.
Thank you, Assemblymember. We have a motion. We have a second. The motion is due pass as amended to appropriations. Madam Secretary, please call the roll.
Bonta?
Aye.
Bonta, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Burke? Burke, aye. Chavez? Aye. Chavez, aye. Chu? Aye. Chu, aye. Gomez? Gonzalez? Hernandez? Lackey? Nazarian? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? Thurman? Aye. Thurman, aye. Waldron? Wood? Aye. Wood, aye. 9 needs one more. Put on call.
You have 9 aye votes. You need one more. We'll put the bill on call, and we'll have other members vote when they return. Thank you, Assemblymember Mullen. We'll now go to our special order of business. Item 14, AB 775. Assembly members Chu and Burke.
Thank you. Thanks, Assembly. Thanks for getting down here. So excited.
Mr. Chair and colleagues, I appreciate your consideration of AB 775, the Reproductive Fact Act. I also want to take a moment and thank the committee consultant for their analysis, and we accept the suggested committee amendments for today. California and our state legislature has a legacy of protecting a woman's constitutional right to choose. AB 775 continues that legacy by ensuring that women can make reproductive choices based on information that is scientifically accurate and timely. Unfortunately, a growing and significant number of organizations have tried to pass themselves off as women's medical clinics while providing false information and risking delays to critical early health care. In California, it's estimated there are over 160 so-called crisis pregnancy centers. We know that timely access to health care when it comes to pregnancy-related services, whether prenatal care or an abortion, is critical and should not be delayed. We also know that lower-income patients have higher rates of complications as well as missed first trimester prenatal visits. Unfortunately, these crisis pregnancy centers often delay that care. This bill helps to make sure that women can make informed decisions with regard to their reproductive choices with accurate and timely information through disclosure. For unlicensed facilities that offer family planning and pregnancy-related services, they'll need to disclose that they are not licensed medical facilities and do not have a licensed medical provider on staff. For licensed facilities, they must provide their patients with a notice that California has public programs to provide immediate, free, or low-cost access to family planning, prenatal care, or abortion services, and how to contact a local social service office. Since this bill has been mischaracterized by some, and let me make it clear what AB 775 does not do. The bill does not require referrals to abortion clinics. It does not provide a preference for one kind of clinic over another. It doesn't prevent any center from providing current ongoing services, and it doesn't discriminate on the basis of religion. I want to thank the diverse group of health providers, women organizations, religious groups, and community leaders who are supporting this bill. I also want to thank our lead co-sponsors, Black Women for Wellness and NARAL Pro-Choice California, as well as our co-authors, Mr. Rendon, as well as Dr. Wood. And I'd like to introduce my joint author for this bill, Assemblymember Autumn Burke.